So today we're going to be running through a really easy and important exercise for anyone that has jaw pain. And we're really concentrating on the tongue now and jaw pain prevention. So my name's Ellie Lindsay, I'm a TMJ myofascial specialist, and these are some of the techniques that I integrate into working with my clients, and I want to bring them to you so that you can practice them at home as part of your self-care if you experience jaw pain, headaches, ear ringing, clicking, any of those kind of symptoms that are in relation to TMJ disorder. So what we're going to be looking at today is the tongue. And firstly, let's just cover quickly why this is important. So firstly, the tongue should actually be involved in the process of chewing food, swallowing, talking. Where we use our jaw, the tongue should actually play a part in that. And if we have kind of a lack of mobility or a lack of strength in the big muscle that is the tongue, then this can cause the rest of the muscles and the structures to actually have to overwork in order to compensate for the tongue not doing its job. So the other reason why we're really interested in the tongue and kind of releasing any tension there is that, as you can see from this diagram, I hope you're not eating your lunch while you're looking at this, but this is actually from a dissection, and this is the fascia. So it's a picture of fascia chain. So as we have sort of spoken about before, and you may have heard me talk about before, we have, according to anatomists such as somebody called Tom Myers, who's really kind of big in this field, we have these chains of fascia that are running through our body, connecting different muscles, structures, even organs, as you can see from this diagram. And the tongue is actually comes through the structure that connects the tongue, comes through sort of down through the neck area and connects to the lungs and the diaphragm. But what's important, you can't see it so well in this picture, but it's the best that I could find, is that there are these connections here to the neck muscles that are basically run right alongside the jaw. So that's one of the reasons why we're also interested in the tongue so much, is because of this fascia connection to the muscles of the neck and the jaw. So that sort of explains one of the reasons why we really want to work the tongue and release any tension there, and also sort of activate it and give it that strength to be able to perform its duty. So with that in mind about how important the tongue is, we're also thinking about another structure in this exercise, which is called the lateral pterygoid. And the lateral pterygoid is a muscle that sits deep within the jaw, and it's actually attached to the disc that comes in and out of the jaw as we open and we close. So if you can imagine kind of any tightness or tension in that lateral pterygoid muscle, which is quite common, that can actually affect the positioning of the disc as we open and we close. So if you get clicking in your jaw, that's usually the result of the disc being displaced. So usually it comes further forward than it should. And one of the causes for that can be that the lateral pterygoid muscle is tight, and that's kind of creating that pulling on the disc itself. So this exercise is also great for the lateral pterygoid to help release tension there. Okay, so we'll get started with it. And what I want to just say quickly first is if this is painful to you, then just stop the exercise, and I'll talk you through a bit more about that at the end. So all we're going to do is just open our jaw to a sort of comfortable position like this. And then you're going to take the tongue out of your mouth and reach it forward and up as far as you can. So that looks like this. And then you're going to bring the tongue back. So you're going to bring it in, sort of scrape over your teeth, go to the top palate, so the top of your mouth, and bring the tongue back as far as you can. So that will look like this. So you're kind of keeping it at the top as you go back, and as you get towards the back of your mouth, you'll probably feel like a bit of a stretch underneath your tongue, which is what we're looking for, as part of what we're looking for. And keep it nice and slow. And ideally what I'd like you to do is to do that 20 times. Now, if you're getting pain in the jaw joint here, then this exercise, whilst you do it, then this exercise probably isn't for you right now. So what we're doing here is when we bring the jaw back, when we bring the tongue to the sort of towards the back of the mouth, we're actually kind of inhibiting the lateral pterygoid. So that involves also a bit of compression in the jaw here. So if you're going through a stage where you have some inflammation in that jaw area, then it's probably best if you leave this exercise and come back to it when things feel like they've calmed down a little bit. So you can keep going as I'm talking. We want to get to 20. I'll just show you what it looks like from the side as well. So I'm just going to be bringing my tongue out as far as I can and sort of pointing it upwards. And then I'm going to be bringing it into my mouth, keeping it as far at the top of my mouth, and then bringing the tongue right back. And ideally you should get to the soft palate, so where the top of the mouth starts to feel a bit softer towards the back. So have a go at that. Hopefully you've got to about 20 by now as I've been talking. And if you can try and do that 2 or 3 times a day, that would be really good. So 2 or 3 sets of 20, and that should really help with the tongue mobility and also that lateral pterygoid, so if you're experiencing jaw clicking. So do let me know how you get on with that.